Hey everyone, welcome to another deep dive. And today we're tackling something that I'm sure you see pretty much every day in your labs,
Oh, yeah,
acute bronchitis.
definitely.
And I know what you're thinking, this is pretty basic stuff, right?
Right.
But we're going to be going a bit beyond the textbook today.
Okay.
And we're going to be looking at some of the latest WHO recommendations from their AWARE publication on antibiotic use.
Sounds good.
So this is going to be a really valuable deep dive for anyone who wants to make sure they're at the forefront of best practices for managing acute bronchitis.
For sure. It's so important to stay updated, especially, in a field as dynamic as ours. And these AWARE guidelines have some really great insights.
Yeah, absolutely.
Yeah.
So to get us started, can you give us a concise definition of acute bronchitis, maybe focusing on the aspects that are most relevant for medical microbiologists listening?
Sure. So acute bronchitis is basically an inflammation of the trachea and the bronchi. And the main thing you see is this persistent cough that lasts for more than 5 days. It can even go on for weeks. And you might also see fever and some sputum production. But the key thing to remember is it's usually self-limiting. So it tends to resolve on its own. And what's interesting for us is that it's most often caused by a virus, not bacteria.
That's a really good point, especially with antibiotic resistance on the rise.
Mm-hmm.
But given those symptoms, how can we differentiate acute bronchitis from something like pneumonia?
Yeah, that's where the clinical presentation is really important. Pneumonia is usually a lot more severe, and you'll see systemic symptoms, so things like shortness of breath, high fever, rapid heart rate, rapid breathing. And if you listen to their chest, you'll likely hear some focal chest signs. But acute bronchitis is usually much more localized to the airways, and that cough is really the main symptom you see.
So it sounds like careful patient assessment is key. Are there any lab tests that are routinely needed for diagnosis?
Generally, no. Most of the time, acute bronchitis is diagnosed clinically based on the patient's symptoms and history. But there are some cases where lab tests might be helpful, like if it's flu season or if there's a viral outbreak happening, then it might be necessary to test for specific viruses like influenza or COVID-19.
Makes sense. So if we're not routinely recommending antibiotics for acute bronchitis, does that mean we don't need to do routine microbiology surveillance?
That's a great question, and it brings up a really important point. Even though we might not need to know the exact bacteria involved because we're not using antibiotics, it's still very important to keep track of what respiratory viruses are circulating. So monitoring the prevalence of things like influenza subtypes, RSV genotypes, and new coronaviruses can really help us understand the big picture, and it can inform public health responses and maybe even help predict future outbreaks.
That's a fantastic point for our listeners to keep in mind. So besides the specific viral tests, are there any other lab tests that might be helpful, like CRP or procalcitonin? Could those help us distinguish between acute bronchitis and pneumonia?
Well, CRP and procalcitonin have been suggested as biomarkers to differentiate between viral and bacterial infections, but they're not perfect. Their sensitivity and specificity aren't that great. So you could end up with false positives, which could lead to unnecessary antibiotic prescriptions, or false negatives, which could mean you miss a case of pneumonia, plus they add extra costs to patient care. So while they might be helpful in certain cases, they shouldn't be seen as a foolproof method for telling the two conditions apart.
Okay, so not a perfect solution.
Yeah.
What about imaging? Is that usually needed for diagnosing acute bronchitis?
No, typically not. Imaging isn't usually required for acute bronchitis. The diagnosis is mostly made based on the clinical presentation and the patient's history. But of course, if there's any uncertainty or any red flags that suggest something more serious might be going on, like pneumonia, then imaging might be considered to rule out other possibilities.
Good to know. Well, let's get into the main topic here. Treatment. We know antibiotics are not usually recommended, but what does the WHO's no antibiotic care approach actually look like?
Right, so the no antibiotic care approach that's outlined in the AWARE guidelines really focuses on two key things: patient education and then symptomatic relief. So we need to make sure we're explaining to our patients very clearly that acute bronchitis is usually self-limiting, which means it'll resolve on its own without antibiotics. And we also need to prepare them for the fact that cough can stick around for a few weeks even after the infection is gone, and reassure them that that's normal.
That's so important, especially since patients often want a quick fix if antibiotics aren't the answer. What about managing the symptoms? What do the guidelines recommend for that?
Well, for symptomatic relief, the AWARE guidelines recommend over-the-counter meds like ibuprofen and paracetamol.
Okay, and what are the recommended dosages for those?
For adults, ibuprofen, the dose is 200 to 400 milligrams every 6 to 8 hours, and the max daily dose is 2.4 grams for paracetamol. It's 500 milligrams to 1 gram every 4 to 6 hours, and the max daily dose is 4 grams for most adults, but it's 2 grams for people with liver issues.
Those are really helpful guidelines to have. What about dosages for children?
Ah, yes. For children, the dosage for both ibuprofen and paracetamol is based on their weight. So the AWARE guidelines give specific recommendations for different weight ranges, which helps ensure that we're giving safe and effective pain relief to our younger patients.
That's good to know. It seems like the no antibiotic care approach really focuses on empowering patients with knowledge and giving them the tools to manage their symptoms themselves. But what if those symptoms are very severe or if they last a really long time? Are there ever cases where you might consider antibiotics for acute bronchitis?
Well, even though antibiotics are not generally recommended, there are a few specific situations where they might be considered, like if the patient has some underlying health conditions that put them at higher risk for complications, or if their symptoms are really severe or they just drag on despite using symptomatic treatment, then in those cases, a course of antibiotics might be necessary.
So it sounds like it's all about personalized medicine and making decisions based on the individual patient's needs.
Exactly. And even when antibiotics are considered, it's really important to choose the right antibiotic based on local resistance patterns and what you think the pathogen might be. And the AWARE guidelines give some really useful guidance on how to choose the right antibiotic and the right dosage for these specific situations.
Okay, so it sounds like the AWARE publication is a really valuable tool for staying up to date on best practices for managing acute bronchitis.
Definitely, it gives a really comprehensive and evidence-based framework for how to approach this common condition, and it really emphasizes the importance of using antibiotics wisely and providing patient-centered care.
All right, well, before we move on to discussing the pathophysiology and epidemiology of acute bronchitis, let's pause for a quick knowledge check. Are you ready for a few exam questions to see how our listeners are doing so far?
Sure, let's test them out.
Okay, question number 1. What is the most common cause of acute bronchitis?
Oh, this one should be easy for everyone, viral infection. Gotta remember that most cases of acute bronchitis are caused by viruses, not bacteria.
Perfect. Okay, question number 2. Which of the following symptoms is not typical of acute bronchitis? Is it a cough lasting more than 5 days? B, shortness of breath, C, mild fever, or D, sputum production?
The answer is B, shortness of breath. So, while cough, mild fever, and sputum production are all common with acute bronchitis, shortness of breath is much more characteristic of pneumonia, which is a more serious lower respiratory tract infection.
Excellent. Okay, question number 3. Why is antibiotic treatment not recommended for acute bronchitis?
Well, we've talked about this a lot. The main reasons are that there's no evidence that it actually helps in most cases. Plus, there's the potential for side effects and the risk of contributing to antibiotic resistance.
Perfect. 2 more to go. Question number 4. What are 2 key components of the WHO's no antibiotic care approach to acute bronchitis?
So the 2 key components are patient education, which means clearly explaining what acute bronchitis is, how it usually resolves on its own, and why we don't use antibiotics. And the second key component is symptomatic relief, which is using those over-the-counter meds like ibuprofen and paracetamol to manage the symptoms.
Great. And for our final question number 5. In what specific situations might antibiotic treatment be considered for acute bronchitis, even though it's not usually recommended?
Antibiotics might be considered if the patient has some underlying health problems that make complications from bronchitis more likely, or if their symptoms are very bad, or if they just last a really long time, even with other treatments. But it's crucial to remember that these decisions should always be made based on the individual patient, considering all the factors involved.
Amazing job, everyone.
Right.
It seems like you've been paying close attention and you've really grasped the key points from the AWARE guidelines. We'll be right back to continue our deep dive into acute bronchitis in just a moment.
Welcome back to the deep dive.
You know, it's amazing how such a common thing like a cough can actually be so complex when you look at what's happening on a microscopic level.
Yeah, it really is fascinating.
So let's talk about that. Let's talk pathophysiology. How does acute bronchitis actually develop in the body?
Well, it all starts with a virus that invades the bronchial epithelium. And then that virus, whatever specific virus it might be, triggers this inflammatory response in the bronchial walls.
Okay.
And that inflammation leads to tissue damage and increased mucus production. And of course, that leads to the cough that everyone associates with bronchitis.
So it's like a microscopic battle going on in our airways.
Yeah, exactly. And you could say the battle scars are the damaged bronchial tissues and that lingering inflammation, which is why that cough can stick around even after the virus is gone.
Makes sense. Now let's shift gears a bit and talk about epidemiology. So we know that acute bronchitis is super common, but who's most at risk for these infections?
Well, acute bronchitis is common across all age groups, but there are some groups that are more likely to get it young children. Their immune systems are still developing, so they're more vulnerable. Older adults, their immune systems might be weakening, so they're also more at-risk smokers because of the damage that smoking causes to their airways. And then people with other respiratory problems like asthma or COPD, they're more likely to have problems too. And then, of course, as we talked about earlier, environmental factors like air pollution can also play a big role.
Right, so it's kind of a mix of different factors all coming together, individual factors, the environment, and of course all those respiratory viruses out there. But let's focus in on the viruses for a bit. Can you tell us more about the specific viruses that are most often responsible for acute bronchitis?
Of course. So as we know, most cases of acute bronchitis are caused by viruses, and the most common ones are rhinoviruses. They're definitely the top culprit. And then you have influenza A and B, parainfluenza virus, coronaviruses, including, SARS-CoV-2, respiratory syncytial virus, or RSV, metapneumovirus, adenovirus, and then a whole bunch of other respiratory viruses.
Well, that's quite a list. Is there anything in particular that stands out to you from a microbiologist perspective?
Well, from a microbiology standpoint, there are some interesting things happening. For example, we're seeing certain RSV genotypes becoming more common, especially genotype A.
Okay.
It seems to be becoming the dominant one, and it seems to be causing more serious illness even in adults.
Interesting.
And then, of course, we always have to keep an eye on the new coronavirus strains as they evolve.
Right. We don't know what they're going to do.
Yeah, exactly. We have to stay on top of it and keep doing the research.
That's a good reminder that the world of viruses is always changing, and we have to be ready for whatever comes next. But for our listeners who might be dealing with acute bronchitis cases in their work, what are the key things to remember when it comes to diagnosis and treatment?
Okay, so the most important thing is making sure you're diagnosing it correctly. You have to be able to tell acute bronchitis apart from other respiratory infections, especially pneumonia. Because remember, pneumonia usually has those more severe symptoms, the high fever, the shortness of breath, the rapid breathing, and then you often hear those focal chest sounds when you listen to their chest. But acute bronchitis is usually milder, and the main thing you see is that persistent cough.
So a careful patient assessment is really important.
Absolutely. And while lab tests aren't usually necessary for routine cases, there might be some situations where you would want to do them, like during a flu outbreak or if you're concerned about a specific pathogen. And then, of course, when it comes to treatment, remember the WHO's no antibiotic care approach.
Right. Can you remind us what that approach involves?
Sure. So the no antibiotic care approach really focuses on patient education and symptomatic relief. So you have to explain to the patient very clearly that acute bronchitis is usually caused by a virus, not bacteria.
All right.
And that means antibiotics won't work. It's also important to let them know that the cough can last for a few weeks and that it's normal, part of the recovery process.
So setting realistic expectations is key.
Definitely. And for managing the symptoms, the AWARE guidelines recommend those over-the-counter meds like ibuprofen and paracetamol. We already talked about the dosages for adults and children, so everyone should have that information handy.
That's right now. Even though we've been talking about how antibiotics aren't usually recommended, are there any cases where they might be considered?
Well, yeah, there are a few situations where antibiotics might be necessary. For example, if the patient has some underlying health conditions that put them at higher risk for complications, or if their symptoms are just really bad, or if they last a really long time even after trying other treatments. But it's important to make these decisions on a case-by-case basis, taking everything into account.
It's all about personalized medicine, right? Making the best decision for that specific patient.
Exactly. And even when you do decide to use antibiotics, you have to choose the right one based on local resistance patterns and what you think the pathogen might be. And their AWARE guidelines give some really good advice on choosing the right antibiotic and the right dosage for these specific situations.
Okay, so it sounds like the AWARE publication is a really important resource for any medical microbiologist who's working with acute bronchitis cases.
I definitely think so. It's a really comprehensive and evidence-based guide for managing this common condition, and it really emphasizes the importance of being careful with antibiotics and putting the patient's needs first.
All right, well, before we wrap up our discussion on acute bronchitis, let's test our listeners' knowledge with a few more exam questions ready to challenge them.
Bring it on.
Okay, Question number 1. Describe the pathophysiology of acute bronchitis. What are the main events that lead to those typical symptoms?
Okay, so the pathophysiology of acute bronchitis starts with a virus invading the bronchial epithelium, and that triggers an inflammatory response in the bronchial walls, which leads to damage and increased mucus production. And that causes the cough that we see with bronchitis, and the damage and inflammation can stick around even after the virus is gone, which is why that cough can last for a while.
Excellent explanation. Okay, question number 2. Which two groups of people are generally considered most vulnerable to developing acute bronchitis?
The two most vulnerable groups are young children because their immune systems are still developing, and older adults because their immune systems may be getting weaker, so both groups are more susceptible to respiratory infections in general.
Great. Okay, question number 3. What's the main reason why antibiotic treatment is not usually recommended for acute bronchitis?
The main reason is that acute bronchitis is usually caused by viruses, and antibiotics don't work against viruses. So using them wouldn't help the patient, and it would just increase the risk of side effects and contribute to antibiotic resistance.
That's a very important point for our listeners to remember. Okay, question number 4. Besides patient education, what's the other key component of the WHO's no antibiotic care approach to managing acute bronchitis?
The other key component is symptomatic relief, which focuses on using those over-the-counter medications like ibuprofen and paracetamol to help manage the symptoms like cough, fever, and muscle aches. And the AWARE guidelines have those specific dosage recommendations for adults and children.
Excellent. And for our final question, question number 5. Let's say you're consulted on a case of suspected acute bronchitis. What are two key clinical features that would help you tell it apart from pneumonia?
Two key features that distinguish acute bronchitis from pneumonia are the severity of the symptoms. So pneumonia usually has more severe symptoms like high fever, shortness of breath, and rapid breathing, whereas acute bronchitis tends to be milder with that persistent cough as the main symptom. And the other key feature is the presence of focal chest signs. So with pneumonia, you often hear those sounds when you listen to the patient's chest that indicate something's going on in the lungs, but those signs are usually absent in acute bronchitis.
Amazing job, everyone. It sounds like you've all aced this deep dive into acute bronchitis. We'll be back in just a moment to wrapping this episode with some final thoughts and takeaways. Welcome back to the deep dive. As we're wrapping up this exploration of acute bronchitis, I'm really struck by just how much there is to learn beyond, the basic understanding.
It's a great example of how even a condition that seems pretty simple can actually be really complex, especially when you're looking at it from a medical microbiology perspective.
Exactly. And speaking of complexity, we've been talking a lot about how the WHO recommends avoiding antibiotics for most acute bronchitis cases, but their AWARE guidelines also give specific guidance on when you would want to use antibiotics, right?
Oh, absolutely. Yeah, they definitely emphasize that no antibiotic care approach, but the AWARE publication recognizes that there are certain situations where antibiotic treatment might be necessary. They take into account things like the patient's individual risk factors, how severe their symptoms are, how long they've been going on, and what the local resistance patterns are.
So it's not like a one-size-fits-all kind of thing.
Yeah. Right. It's not like that at all. So, for instance, if a patient had some other health problems that make them more likely to have complications from bronchitis, or if their symptoms are really bad, or if they just haven't gotten better even with other treatments, then a course of antibiotics might be the way to go.
And in those cases, the AWARE guidelines give specific advice on which antibiotic to choose and what dose to use.
Yeah, they do. They talk about how important it is to choose an antibiotic that's likely to work against whatever pathogen you think is causing the infection. And they say you have to consider those local resistance patterns, and then they give very clear guidance on the right dosages and how long to give the treatment for both adults and children.
That's really useful information for our listeners. It's like having a guide to help you figure out those trickier cases.
Exactly. And it just shows you how important it is to stay current on the latest guidelines and recommendations, because things are always changing when it comes to antibiotic use and resistance.
Well said. So as we wrap up this deep dive, what are some of the key takeaways you want our listeners to remember about acute bronchitis?
The most important thing is to make sure you're diagnosing it accurately. You have to be able to tell the difference between acute bronchitis and other respiratory infections, especially pneumonia, because you don't want to be prescribing antibiotics when they're not needed.
Right, and patient education is really important too.
Oh, for sure.
We need to make sure our patients understand what acute bronchitis is and how it usually goes away on its own and why we don't usually use antibiotics.
Yeah, I completely agree. Clear communication and realistic expectations can really help put the patient at ease and make them feel like they're part of the decision-making process.
Excellent points. And we shouldn't forget how important it is to keep learning and staying up to date on the latest research and guidelines like the WHO's AWARE publication, so we can make sure we're giving the best possible care.
Absolutely. The world of microbiology is constantly evolving, so our knowledge and our practices have to evolve too.
Well said. So to leave our listeners with a final thought, acute bronchitis is really common and it can be misdiagnosed and lead to overuse of antibiotics. So what are some things we can do in our labs and in our clinical practice to improve diagnostic accuracy and promote responsible antibiotic use?
That's a great question to think about. It really highlights the need for ongoing education, for collaboration between clinicians and microbiologists, and for a commitment to making decisions based on evidence. We need to keep striving for accurate diagnosis, responsible antibiotic use, and ultimately the best possible outcomes for our patients.
Thank you for joining us for this deep dive into acute bronchitis. We hope you found it helpful and informative. Be sure to subscribe and share this episode with your colleagues. Until next time, stay curious and keep diving deep.